Hi, everybody. Welcome to today's session on addressing food insecurity in adolescent patients. We are going to go ahead and get started in just one moment. If you haven't already, make sure you access your chat feature so that you can enter any questions or participate in the interactive portions of today's session. All right, it is 1 o'clock, so we are going to go ahead and start today. So welcome to Address Food Insecurity in Adolescent Patients. Today's webinar is brought to you by the Adolescent Health Initiative, Food Gatherers, and the Regional Alliance for Healthy Schools. So I want to share with you a little bit of information about the Adolescent Health Initiative. AHI provides training, technical assistance, and coaching to healthcare providers, health systems, and youth-serving organizations across the country to improve adolescent-centered care. We are based out of the University of Michigan, but as I said, we serve a national audience of health professionals. And you can learn more about our work at the adolescenthealthinitiative.org. I'm Lauren Rinaldi, the director of AHI, and I'm joined today by two fantastic guest experts. Shira Daya is a nutrition program manager with Food Gatherers, the Food Resource and Food Bank program serving Washtenaw County in Michigan. Shira manages their growing collection of health and nutrition initiatives and supports the Healthcare and Food Bank Partnership Initiative that recognizes food insecurity as a social determinant of health and creates a connection between healthcare providers, local healthcare institutions, and Food Gatherers' network of partner pantries. Allison Mankowski is a registered dietitian who has worked with the Regional Alliance for Healthy Schools for 6 years. She obtained her master's in public health from the University of Michigan, where she also attended undergrad. Her other professional work focuses on sports nutrition and eating disorder recovery. Our objectives for today's training is that by the end, you'll be able to describe food insecurity and hunger. You'll be able to recognize how food is a social determinant of health, describe the unique challenges faced by adolescents who struggle with food insecurity, and examine the role of physicians and health providers in helping adolescents connect to food and community nutrition resources, and also increase your comfort level with routine screening for food insecurity with adolescent patients. So I'm now going to turn it over to Shira to begin the presentation.
All right, thank you, Lauren, for that introduction. Hello, everyone, and thank you for joining us today to learn more about food insecurity in the U.S. and ways that the healthcare community can better meet the needs of adolescent patients who struggle with hunger. Let's begin by talking about the work of Food Gatherers, and then we'll move into a discussion of food insecurity more generally. Food Gatherers is the food bank and food rescue program serving Washtenaw County, Michigan. Our mission is to alleviate hunger and address its causes in the community. In Washtenaw County, 1 in 7 struggles with food insecurity. That equates to nearly 50,000 people, of which 8,000 are children. This past November marked 31 years of fighting hunger where we live. This truck that you see here in the photo with our beloved carrot logo is one in our fleet of 7 refrigerated trucks out on the road each day. These trucks are either picking up food to be sorted in our warehouse or delivering food to our partner pantries, who will then distribute it to our neighbors in need. Food Gatherers works with more than 170 community agencies providing food assistance. We strategically leverage both federal food programs and local charitable efforts to ensure that any Washtenaw County resident facing food insecurity has access to healthy food. We train our partners in civil rights and food safety and provide technical assistance and resources to partner food pantries to increase their capacity to store and distribute healthy food. At Food Gatherers, we connect the dots between hunger and health, and for many years, our focus on providing healthy food has been a driving feature of our work. In 2018, we distributed more than 6.5 million pounds of food to our community. More than 60% of that food was either fresh produce or protein including milk, eggs, and meat. We serve nearly 45,000 individuals annually through our network of 170 partner programs or food pantries that are located throughout the county. This photo over here shows one of our pantries at the Ypsilanti Health Center, which is a community health clinic of Michigan Medicine. As you can see, there's a good variety of fresh produce, including berries and melons. They've got nice baskets holding bags of beans and whole grains. What's especially nice about this small pantry is that it is located inside a health clinic. When a patient screens positive for food insecurity, they can shop the pantry and are given names and locations of other pantries in our network to visit. The majority of our pantries are choice style, so clients can choose the foods they want to take home based on their own dietary needs and preferences. Most of our partner programs operate in community and faith-based locations. We also have school-based pantries serving preschools and K through 12, and we partner with universities to bring free grocery programs to college campuses. For those of you that are less familiar with this, food insecurity on college campuses is at record levels. This is due to the high cost of tuition, living, and meal plans. So this is something to keep in mind when strategically thinking about food insecurity and food access programs serving older adolescents. In addition to our pantry programs, Food Gatherers engages in a variety of direct service programming. We operate a community kitchen, a licensed commercial kitchen which serves hot meals daily to anyone in need. We typically serve more than 200 meals a day. We run a healthy school pantry program where any child enrolled in a participating school can receive a free box of fresh produce every month. And during the summer, Food Gatherers coordinates with community partners to provide free meals to school-aged kids through the Summer Food Service Program. This past summer, we served 54,000 free meals and provided more than 1,000 boxes of free produce to participating families. And then, as a complement to our existing network of partner agencies, Food Gatherers sponsors perishable food distributions or neighborhood grocery initiatives at low-income housing sites in urban areas of the county. So this was just a short introduction to the work that we do. You can visit us at foodgatherers.org to learn more about our hunger relief efforts, including advocacy and capacity building work. And if you're local, you can come visit us in person. So let's back up a little and talk about food insecurity more generally. What is food insecurity? The USDA defines food insecurity as a household-level economic and social condition of limited or uncertain access to adequate food. What that means is that individuals living in food-insecure households do not always have the resources to purchase the food they need. You might hear the term hunger, too. Hunger is that physiological condition of needing food in your belly. It's an acute feeling in your body. Hunger may result from food insecurity, but not all individuals who struggle with food insecurity also experience hunger. So you might hear me use the terms food insecurity and hunger interchangeably throughout this presentation, but keep in mind that they are technically two different things. So in a clinical setting, for your patients of any age, being food insecure means your patients do not have access to the foods they need for a healthy and often active life. When we think about food insecurity, it's important to remember that food insecure households are not necessarily food insecure all the time. Many of us find ourselves right on the balance between making all of our payments, yet not having any extra funds around. So a sudden job loss, a car breakdown, each of these events can disturb a very tight budget, leaving less money for food. Thinking ahead to the upcoming holiday season, kids are home from school and now they need a breakfast and lunch that they may have been receiving at a free or reduced price at school. The same thing can happen with a string of snow days. There are lots of reasons why a household might experience food insecurity sometimes, but not always. In addition, food insecurity may reflect a need to make trade-offs between important basic needs, such as housing or medical bills, and purchasing nutritionally adequate food. In the U.S., 1 in 8 Americans struggles with food insecurity. That means more than 40 million Americans, including 11 million children. Rates of food insecurity are higher than the national average in households that include children, those that are headed by single women or single men, households with men or women living alone, Black and Hispanic headed households, and households in principal cities. But while rates may be higher, it's important to reinforce that in our pantries, we serve a very diverse client pool. We see children, adults, and seniors. We see the very low income to those who are employed. We serve clients from a variety of backgrounds, races, and ethnicities. Hunger doesn't have a face, and you can't tell just from looking at someone or noticing how they are dressed, for example, if they are struggling with food insecurity. You have to talk with them about it. So depending on where you are in the country, you may find that rates of food insecurity are significantly higher than the national average. Here in Michigan, we have a rate of about 13%, 13.7%, which is nearly 1 in 7. But in Mississippi, for example, more than 19% of the population, or close to 1 in 5, struggles with food insecurity. You can find a lot more information on rates of food insecurity at the state and county level from Feeding America, and the link is provided there in the corner of the slide. Here is a snapshot of what that interactive map looks like from Feeding America. I encourage you all to take a look and play around with it. Feeding America, by the way, is the nation's leading domestic hunger relief charity and is a nationwide network of member food banks, of which Food Gatherers is a part of it. And they also make great maps. So I want to briefly review some of the federal nutrition assistance programs that are available and most relevant to the adolescent population. These federal programs are essential to fighting hunger in the U.S. As we work to fill in the gaps, it's important that we all work together to increase participation in these existing federal programs among those that are eligible. We can also advocate fiercely to increase funding and eligibility for these programs, and that becomes especially important in today's political climate, where we find these programs are constantly under threat. I've included a link below to help you sign up for advocacy alerts from Food Gatherers. So first, the Supplemental Nutrition Assistance Program, also known as SNAP, formerly known as food stamps, is the nation's first line of defense against hunger in America. It helps put food on the table for millions of Americans who would otherwise go hungry. There are nearly 40 million Americans who receive SNAP, including more than 9 million families with children. Just to give you a sense of the scope of this program, for every 1 meal that charitable food assistance provides, SNAP provides 9. So we cannot lose SNAP. The average monthly benefit is about $4 per person per day. Benefits are delivered monthly to eligible participants through EBT cards that can then be used to purchase groceries at participating stores. It is a highly efficient and effective program that has been shown to lift people out of poverty, of difference to the long-term health of participants. Then we have the National School Lunch Program and Breakfast Programs, which provide free or reduced school meals to income-eligible kids every day. These programs address child hunger and promote good nutrition. With over 1 in 5 children in the U.S. living in a food-insecure household, the National School Lunch and Breakfast Programs play a critical role in the healthy development, long-term health, and educational outcomes for low-income children. In the summer, we see the USDA's Summer Food Service Program operating to provide free meals to kids who might otherwise go without. So let's talk a little bit about the experience of food insecurity and give you all the opportunity to chat in some ideas. So using your chat feature, why don't you share some ways that food insecurity shows up in daily life? How might hunger and food insecurity affect an individual's activities, feelings, experiences? So just feel free to share some informal ideas. All right, so we've got a quiet audience today, which is fine. We can talk through this a little bit. So the experience of food insecurity can show up in different ways. We can think of food insecurity as a spectrum, and depending on the amount of financial and other resources available for food Food insecurity can affect a person and their health differently. Reflecting on this, some individuals may be constantly worried that food will run out. Others may not have enough food. Some may struggle to afford balanced meals, may cut the size of a meal or skip meals, or eat less than they feel they should. When we start to consider the experiences of those struggling with low or very low food security, which translates to high or very high food insecurity, individuals may eat less than they feel they should, feel hungry but do not eat. We might see weight loss, poor control or management of health conditions. We might see people going full days without eating. The list goes on, and it is by no means comprehensive, but it's here to illustrate some ways that food insecurity can affect a person's every day. What we do see consistently are spending trade-offs. We know that our clients are making tough choices every day as to where to spend their limited funds. Nearly 60% of our clients are choosing between buying food and paying for medicine or medical care. 56% are choosing between buying food and paying their utilities. 64% are choosing between food and transportation. 47% are choosing between buying food or paying for housing like rent or mortgage. And 28% are choosing between food and education. How do you make these choices? These are impossible choices. What we see is that food is the most flexible. You can change the quality or quantity of food you buy, but you have to pay your whole rent. This means that households are often making significant compromises to the nutritional quality and quantity of food they are purchasing in order to have enough. And actually, 88% of clients we serve report purchasing inexpensive, unhealthy food because they could not afford healthier options. We also see this coping strategy reported among adolescents who participate in or manage grocery purchases for the family. Out of necessity, the fresh and healthy foods like fruits and vegetables, lean proteins, whole grains, the foods that we recommend for a healthy lifestyle, are not a realistic option and don't make it back home. They are more expensive, they spoil faster. Think about what this does then for the foodscape in the household, for the overall nutrition and dietary intake, for the developing taste buds and food preferences of young family members, for short and long-term chronic disease prevention and management. So we're starting to see how the experience of food insecurity can put people at greater risk for negative health outcomes. When we consider the lived experiences of adolescents who struggle with food insecurity, research is limited. But we do know a few things, and it's important to consider these factors and the unique experiences of adolescents when planning outreach or other food access programming for this population. We do know that approximately 6.7 million youth ages 10 to 17 receive assistance from the Feeding America network of food banks each year. So hunger among the adolescent population is widespread. According to the few studies that have focused on adolescent hunger, most teens are aware of classmates or neighbors who did not have enough to eat on a regular basis. Food insecurity on college campuses is at a record high. Adolescents may also experience additional embarrassment or a fear of stigma. Therefore, they may avoid food assistance delivered in publicly visible settings or from people outside a trusted circle of friends. So incorporating food into other programming and services is a much more desirable and likely effective approach to food assistance for adolescents. While parents and caregivers may try and protect teens from hunger, teens in food insecure households often take on a role of managing food for the household. This could include making purchasing decisions about the types and quantity of food to bring in and how to make food last longer. As I mentioned earlier, purchasing higher cost, healthy and fresher food may not be a priority. It's more expensive, there's less of it, it spoils quicker. So getting the largest quantity of food, no matter what kind of food that is, may be the first priority. Depending on the level of food insecurity being experienced at home, teens, or adolescents more generally, may use multiple coping strategies. They may shrink or skip meals to help a younger sibling from feeling hungry. They They might go over to a friend or relative's house to eat in order to keep more food available in the household for other family members. They may save a school lunch for the weekend. Despite carrying additional responsibility for food acquisition and management, adolescents might not be completely aware or tuned in to what food resources are available to them. We also see an increased risk for mental health conditions like chronic stress, anxiety, and depression. We see an increased risk for substance abuse and even behaviors like shoplifting, either for food or for cash for food. Again, there hasn't been a lot of research done in this segment of the population, but there are a few publications available on the Feeding America website that I encourage you all to review. They are listed later on in this presentation. But you can also just do a quick search for Feeding America and teen hunger, and it'll pull the research right up. So throughout this presentation, I've been leading you towards this, but let's take a step back and consider hunger and health more generally. So what exactly is a social determinant of health? Social determinants of health relate to the fact that only about 20% of a person's health status can really be determined by the healthcare services they receive. As it turns out, there are many social and environmental factors that play a much larger role in determining if a person has a good chance of staying healthy or not. Food and food insecurity are among those factors. What we know is that food insecurity can affect health regardless of age, gender, ethnicity, or other demographic characteristics. If food insecurity, when you control for all other demographic characteristics, can affect health status so clearly and definitively, food insecurity is a major public health concern. We know that food insecurity negatively affects health across the lifespan, including in pregnancy, among infants, children, adolescents, adults, and seniors. Individuals living in food insecure households are more likely to report poor health and depressive symptoms. They have a higher risk for chronic disease, such as diabetes, hypertension, heart disease, obesity. We see that the risk of type 2 diabetes, for example, is 2 times higher in food insecure individuals. Food insecure patients managing diet-related chronic diseases are also more likely to have lower disease control, such as elevated A1C levels. And so what we find is that food insecure individuals are at a higher risk for diet-related diseases and poor health outcomes. Over the past 2 years, Food Gatherers has been strengthening our partnership with healthcare providers in the community. Our Healthcare and Food Bank Partnership Initiative recognizes food insecurity as a social determinant of health and creates a connection between healthcare providers, local healthcare institutions, and Food Gatherers' network of partner pantries. We launched a hunger and health training program for medical residents at U of M and St. Joe's hospitals to help our physicians learn about food insecurity in our community and better connect the dots between hunger and health. We've advised both IHA and Michigan Medicine on how to implement the Hunger Vital Sign, which is the validated 2-question food insecurity screening tool, which identifies households at risk of food insecurity. And that's been implemented in primary care clinics. We've also partnered with the Regional Alliance for Healthy Schools to reach adolescents and their families, which Allison will talk to you more about in just a minute. So before I hand the presentation over, I want to give you all some final thoughts on how institutions like schools, hospitals, clinics, universities, for example, how they can better address food insecurity within the population you serve. So the first and foremost is to increase participation in federal nutrition assistance programs like SNAP and the National School Lunch and Breakfast Programs. Learning about local community food resources like your local food bank or food pantries and meal programs that are available will also be really helpful. Integrating healthy food access programs into existing curriculum and institutional level activities, and then screening for food insecurity if it's relevant to your organization using the Hunger Vital Sign and referring patients to existing resources. Lastly, and I can't stress this enough, advocate for continued funding and increased eligibility for SNAP and other federal programs that fight hunger. I've provided a link to Food Gatherers' advocacy page if you're local, and if you're joining us from outside of Michigan, you may want to sign up for the national level alerts from Feeding America. So at this point, I'm going to turn the presentation over to Allison with the Regional Alliance for Healthy Schools, so she can share their experience with implementing food security screening and referrals into school-based clinics and services.
Thanks, Shira. Hi, I'm Allison, Registered Dietitian for the Regional Alliance for Healthy Schools. I'm going to share with you how our clinics were able to work together with food gatherers to develop a program to address food insecurity in our adolescent patients. But before I talk about our partnership, I wanted to take a minute to give you a bit of background on our clinics. The Regional Alliance for Healthy Schools, or RAS for short, opened in 1996 in Ann Arbor, Michigan. RAS school-based health centers provide physical, emotional, and preventative health care to youth, and we are now located in 18 different elementary, middle, and high schools in Washtenaw and Genesee counties. These health centers function the same as any normal health clinic, providing health services like physicals, immunizations, and treatment of illnesses and injuries, as well as mental health care with our social workers and nutrition services with our registered dietitians. These services are provided to our youth regardless of insurance coverage or ability to pay, and they're located directly in their schools. In the fall of 2018, RAS and food gatherers formed a partnership aiming to increase food insecurity screening and emergency food resources for our patients. This partnership served to meet many goals for both RAS and food gatherers, but most importantly, we knew that increased food resources could lead to improved health for those who access the program. In addition to increasing screening and food resources for our patients and their families, RAS also hoped that this program would help expand our relationship with community partners. For food gatherers, in addition to wanting to increase the quality and quantity of food resources available, they also wanted to identify which areas of Washtenaw County had the highest levels of food insecurity. In addition to this, they also hoped to educate others about food insecurity and motivate them to engage in this fight against hunger. So, through this partnership, we began providing emergency food boxes at 6 of our RAS clinic locations: Scarlett Middle School and Pathways to Success Academic Campus in Ann Arbor, and Ypsilanti Community Middle School, Ypsilanti Community High School, Ypsilanti Lincoln Middle School, and Ypsilanti Lincoln High School, located in Ypsilanti. These emergency food boxes contain enough shelf-stable food to feed a family of 4 for 2 days, and each site was provided with 3 different meal kit options to allow for a variety of food to be provided to our patients. The boxes also contain a recipe card and a food resource list that contains local food resources. At these RAS clinics, all patients are screened at least once a year by one of the providers by asking the 2 questions you see here on the slide. I was worried whether our food would run out before we got money to buy more, and the food we bought just didn't last and we didn't have money to get more. They could answer these questions with often true, sometimes true, or never true. This screening of all patients with these 2 questions is endorsed by the American Academy of Pediatrics as the hunger vital sign, which was mentioned earlier in the presentation. After the screening, if the patient answered either of these questions with sometimes true or always true, they were asked in a variety of ways whether they felt they didn't have enough food for tonight or for the next few days. If this was also true, they were then offered an emergency food box and given a short survey to collect zip code and fruit and vegetable intake data. We provided the patient with a nondescript black string bag to take home the food discreetly. As was mentioned earlier, sometimes there is some stigma with receiving these food resources. Afterwards, RAS's care coordinators would follow up with the family to provide info on additional community food resources as needed. In order to better assess our data for this program, we tracked all boxes given to each student in our electronic health records. From this, we could then run reports on how many patients were screened, how many total boxes were provided, and how many were provided at each location, along with other important data. This tracking was also done to assure that the patients were being screened annually. Through our first year of this partnership, we've seen some very promising results. Across all 6 participating clinics, we've screened almost 1,700 patients for food insecurity. And through these screenings, we've had, on average, about 18% of respondents report a positive response to either of the screening questions. This correlates pretty closely with data from the American Academy of Pediatrics that about 1 in 6 children live in a food insecure household. In total, over our first year of the program, we provided a total of 144 emergency food boxes to our patients. Next, I'd like to share with you a few examples of how we've used these boxes in our clinics. I think this really showcases the wide variety of the ways that food insecurity can present in our adolescent patients. For example, I had one student that I've worked with who reported to me that she had very limited food availability at home. And this was because most of the household food was going to her younger siblings. We were able to provide her with the box, which she was able to keep in her room so that she could have her own personal food items to help support some of the work that I was doing with her. We also had another student who had severe anxiety issues around eating lunch in the cafeteria, and their family was unable to provide food for lunch from home. We were able to give them a box which they could keep in the counselor's office where they would go each day to eat lunch. Also, last winter, we had some pretty major weather events and knew in advance that the school was going to be closed for multiple days. We were able to set up a table outside the clinic on that last day of school before the snow days so that we could provide boxes to multiple students in need to cover those gaps created with no access to school breakfast or lunch programs. Despite our many successes with this program, there are of course also challenges. Some of the biggest challenges we found during our first year are many times the youth may not be aware of financial status at home. And even if they are aware, they may have a negative perception of receiving food assistance and be uninterested in our program. We've also found that follow-up after receiving the boxes can be a little inconsistent, which can make it difficult to assess the impact of our program. Another challenge, as with any food resources, is that the food we have available to provide may not always match with our patients' food preferences. And of course, it can sometimes be difficult to manage the logistics of food storage and delivery. So now, if you're interested in sharing, we'd like to hear a little bit from you. We'd like to hear why you think it's important for anchor institutions like schools, universities, hospitals, and health clinics to integrate healthy food access programming like food security screening and referrals, or even actual food resources into their existing programming. Please type your thoughts into the chat box. Looks like you guys are still being pretty quiet out there, but hopefully you're taking a couple minutes to just kind of think of some of your thoughts on this. So, in addition, hopefully, to some of the thoughts that you've had, or maybe these do correlate with some thoughts that you've had, we found that having a multidisciplinary approach which is often present in these locations, can be really helpful. Patients may connect differently with each provider and may, for example, feel comfortable telling the registered dietitian about their food insecurity status, but not feel comfortable talking with the medical provider. Also, having multiple providers address it can help to destigmatize food insecurity. This type of a situation also creates an opportunity to connect the dots between hunger and health. And in general, it just makes it easier for those who need access to get these food resources. So, we'd like you to maybe think for a couple minutes, and if interested, share in the chat box on what you think might be next steps for your clinic or institution to help adolescents connect to food and community nutrition resources. Please type your answers if you'd like, or just go ahead and think of a few, and we'll come back in a sec. So, we recognize a program like ours may not be feasible in all locations or may take a while to get started. As Shira discussed earlier, if in-house food assistance is not a possibility right now for you, your clinics can also help your patients who need additional food resources by implementing a screening program, just like any other vitals you might do, and also be able to provide them with information to help them access the available resources that are already present in your community. We've shared quite a bit of resources with you today, so we've compiled it all into a slide here. Feel free to visit any of the links to learn more about some of the work that we do, or learn more about how to advocate for continued funding, increased eligibility for SNAP, or other federal programs. You can check out the awesome maps from Feeding America, or also read a little bit more about hunger as a vital sign and how to address food insecurity in the AAP tool for pediatricians. That now wraps up our presentation. Thank you to all of us for joining us today. We do have a few minutes for questions, so please enter any questions that you have, and hopefully we can touch base and fill those in for you. Thank you, Allison and Shira. As Allison just said, we do have time for questions. So if you have any specific questions for our guest experts about implementing a food insecurity or emergency food program, about conducting screenings, or even about specific patient scenarios, Allison and Shira are available to answer your questions. As those questions are starting to come in, I'm going to just go ahead and let you know about some additional resources that are available to you through the Adolescent Health Initiative. So we have resources including additional webinars and trainings, videos that have been conducted by our Teen Advisory Council on anything from teen self-advocacy and perspectives of transgender adolescents in healthcare, to videos on what parents can do in helping their teen transition into an empowered healthcare consumer. We have starter guides that talk you through a lot of different HEDIS measures and how to make positive changes and integrate quality improvement initiatives into your clinic. Number of health center materials, including posters and handouts, and also Spark trainings that are free and ready to use on our website. These Spark trainings are on a variety of different topics, including everything from cultural responsiveness, nonverbal communication bias, an entire series on patient-centered care for LGBTQ+ youth, adolescent brain development, and other topics such as being youth-friendly and identifying victims of human trafficking in healthcare settings. Each presentation comes with a PowerPoint, a script, and handouts. They're about 15 minutes long and intended to be presented to a multidisciplinary audience. So, for example, during a team meeting in your health center or organization, and they're ready to use and free and available on our website.
We will be sending out the slides and links from today's presentation along with a recording of this session. We'll include contact information so that if you do have additional questions, you can feel free to get in touch with us. This is how you can reach out to the Adolescent Health Initiative. You will be getting an evaluation following right after this presentation. We hope that you'll fill it out to provide some feedback and also share what other topics you would like to see in future trainings or webinars. And I also just want to remind everyone that the 7th Annual Conference on Adolescent Health will be taking place in Detroit this year on April 20th and 21st. This is an international event that draws a multidisciplinary audience of healthcare professionals, so physicians, nurses, social workers, dietitians, youth-serving professionals, health educators, clinic administrators, etc., from over 43 states and 11 countries. Right now, our 2020 Excellence in Adolescent Health Award nominations are open and available. So if you know of a team or an individual, including yourself, who is doing excellent work in the field of adolescent health, please complete a nomination on our website by January 31st. All right, if there are no questions for today, we will go ahead and get wrapped up. Thank you again for your participation, and we will check in with you again soon. Take care.